You're pregnant, you get a headache or fever. You reach for paracetamol or acetaminophen, known with brand names Tylenol or Panadol. It's what doctors have recommended for decades. But now you hear on the news, Tylenol may be linked to autism. What should you believe? That's what I'd like to address today, from the standpoint of cardiovascular risk, obstetric care, and the evolving scientific evidence. So let's break down the science in simple terms. As a cardiologist seeing pregnant women, a big part of my job is helping to manage hypertensive disorders of pregnancy. Around 10% of pregnancies develop hypertensive disorders, like gestational hypertension and preeclampsia. Preeclampsia is a pregnancy complication marked by high blood pressure and signs of organ damage, often the kidneys or liver, diagnosed after 20 weeks of pregnancy. One of the most common complaints related to high BP is headache. Sometimes headaches are harmless, other times not. When a pregnant patient complains of headache, we always think, is this benign, like tension headache? Or is it a red flag for worsening hypertension, preeclampsia, or other brain-related causes? When it's safe and we just need pain relief, the medicine we turn to most is paracetamol, or Tylenol. It has long been considered the safest choice for pain and fever in pregnancy, especially if compared to other painkiller groups like ibuprofen that may carry more fetal risk. Recently, public attention has turned to claims that prenatal exposure to acetaminophen might increase the risk of autism spectrum disorder. This can be seriously worrying for parents-to-be. Let me walk you through what the scientific literature says, its strengths, limitations, and what I tell my patients. First, association doesn't imply causation. This means that just because two things appear linked, like Tylenol use in pregnancy and autism, it doesn't prove that one causes the other. They might simply occur together due to other hidden factors. A 2021 meta-analysis in Nature Review's Endocrinology journal reviewed dozens of studies and suggested there might be an association. But the authors themselves admitted, this does not prove cause and effect. Many confounding factors like maternal illness, fever, and genetics could play a role. Another recent systematic reviews called Navigation Guide, led by researchers at Mount Sinai School of Medicine in US, reviewed 46 studies and noticed some connection between Tylenol in pregnancy and autism. But they stressed it doesn't prove cause and effect. So what do the major medical organizations say? As of 2025, multiple professional healthcare organizations, including ACOG, American College of Obstetricians and Gynecologists, have reaffirmed that acetaminophen plays an important and safe role in pregnancy care. The Society for Maternal-Fetal Medicine, or SMFM, has also emphasized that untreated fever and pain carry their own serious risks, example miscarriage, birth defects, preterm birth, and that the current evidence linking acetaminophen to autism is inconclusive. The World Health Organization, WHO, has explicitly stated that there is no conclusive scientific evidence linking acetaminophen use during pregnancy to autism. Tylenol isn't just for headaches. It's also the safest medicine to bring down fever in pregnancy. And fever itself can be dangerous. A large review published in 2017 found that high maternal temperature in early pregnancy was linked with higher risk of miscarriage and neural tube defects. Other studies linked untreated fever to preterm birth and low birth weight. That's why groups like the American College of Obstetricians and the Society for Maternal-Fetal Medicine recommend paracetamol as first-line treatment when pregnant women have fever or pain. Some scientists suggest that acetaminophen may cross the placenta and possibly affect the baby's brain through stress, hormonal changes, or genetic switches. But these ideas are still theories and haven't been proven in human studies. Another study has suggested possible associations of maternal acetaminophen use with development of preeclampsia. These results suggest that dose, frequency, and duration matter, and that indiscriminate chronic use might carry more risk. Though again, nothing conclusive. More studies in 2022 conducted in Sweden with over 2.5 million children found no causal relationship once researchers controlled for genetic and family factors. In September 2025, The FDA announced it will update labeling to reflect that some studies suggest possible associations, but the agency clearly said no causal relationship has been proven. Remember, treating fever during pregnancy is crucial for both you and your baby's health, and paracetamol remains a safe and effective option. Regulators are cautious, so the evidence is mixed, but not definitive. This is why no medical authority has banned Tylenol in pregnancy. As a cardiologist, here's how I explain it to my patients. Yes, you can take Panadol or Tylenol. Use the lowest dose that works, for the shortest possible time. Don't take it every day unless prescribed. Avoid chronic or frequent usage without medical oversight. Always weigh risks versus benefits in context. Example, high fever untreated is a recognized threat. If you have a headache, let your doctor check your blood pressure and rule out preeclampsia. Offer alternative non-pharmacologic pain relief like rest, hydration, stress management, physical therapy. And if you have a fever, don't ignore it. Treat it, because the risks of fever are much clearer than the possible unproven risks of Tylenol. I emphasize that medical decisions are not black and white, and this applies to all areas of medicine. If you took Panadol while pregnant, don't panic. You didn't harm your baby. Millions of women have used it safely over decades. The risk, if any, is likely very small, and the benefits of controlling fever and pain are real and important. The most important thing is informed, cautious use, not fear. So here's the bottom line. Fever in pregnancy is dangerous. Tylenol remains the safest way to treat it. Studies linking it to autism are interesting, but not conclusive. And leading medical organizations, ACOG, SMFM, WHO, and FDA, all agree. Tylenol can still be used safely in pregnancy when needed. If you're pregnant and worried about blood pressure, headaches, or medications, always consult your doctor. Subscribe for more evidence-based answers to trending health questions.